Hi, welcome back to our EMS Incident Command channel. Today we're going to talk about the top 10 structured risk management assessment skills for EMS, paramedics, and firefighters. Sometimes called the what-if method, a what-if assessment is a structured brainstorming method of determining what, when, where, who and how things can go wrong and evaluating the likelihood and consequences of those situations occurring. The answers to these questions form the basis for making informed decisions regarding those risks and determining a recommended course of action to safely mitigate them and avoid harmful consequences. The assessment process involves identifying the specific tasks that need to be performed, determining the potential risks associated with each task, and developing strategies to mitigate those risks. It requires careful consideration of all aspects of the incident, including the number and severity of injuries, the available resources, and the ever-evolving conditions at the scene. Ours is a high-risk profession with a low margin of error, and it is important for paramedics and firefighters to have the skills and knowledge necessary to manage risks effectively and to keep everyone at the scene of an emergency safe, regardless of the type of incident at hand. We'll also discuss related oral interview and promotional testing tips. So, let's get started. 1. Hazard identification. The first skill that firefighter and paramedics need to have is hazard identification. We need to be able to recognize potential hazards and assess the risks associated with them. This involves being able to identify potential risks and hazards before they become dangerous. Ask yourself, what-if questions. What could go wrong? What would happen if things went wrong? Who is at risk or could be at risk? Where is the area of greatest danger? When could members of my team be at risk? How likely is the risk? How could we manage risks? Promotional testing tip. As you are given a testing scenario, ask yourself the what-if questions and include them in your responses. This will let your evaluators know you have identified potential hazards and that you are committed to the safety of everyone at the scene. After all, no one wants a leader that could put others in danger. 2. Situational awareness. The second skill is situational awareness. The ability to maintain situational awareness in a dynamic and constantly changing emergency scene is essential for firefighters and paramedics. We need to be able to assess the situation and adjust our approach accordingly as the emergency scene evolves. Staying alert to your surroundings while continuing to evaluate the what-if questions will help you maintain a 360 degrees of situational awareness. This begins even before you're ever dispatched to the incident and continues all the way through until everyone has safely returned to quarters. Encourage others to maintain a heightened situational awareness and allow for anyone to raise a red flag to ensure the safety of everyone. Promotional testing tip. Be prepared to show your test evaluators you are paying close attention to rapidly evolving emergency situations and your surroundings in your responses. Be clear, concise, and offer smart solutions. 3. Decision making. The third skill we'll talk about today is decision making. Avoid tunnel vision and take a few seconds to consider the risks and benefits of different options and make decisions based on the information available to you, your ever-evolving structured risk management assessment, your patient's conditions, best interests, and department and/or EMS region protocols. Promotional testing tip. Practice making quick and effective decisions in high-stress scenarios. Come up with scenarios and practice verbalizing your response, step by step, out loud. Recording and timing yourself will help you become better at making fast and appropriate decisions in a high-stress environment. During the interview, discuss how you weigh the risks and benefits of different options and how you arrived at those decisions. 4. Implement decisions. The fourth skill is implementing decisions. After you have determined the appropriate actions necessary to avoid, reduce, or eliminate the risks, you must act. Actions taken should be performed with a goal to increase the safety of the operation as a whole. Choosing an inadequate standard operating procedure, standing medical orders, protocols, policies, or procedures for the given situation will increase risk to first responders. Thorough knowledge of your department's guidelines is key in implementing the best decision. Promotional testing tip. The only way to prepare for this is to first study all of your department's orders, protocols, procedures, and other guidelines. Once you have mastered the study materials, then you can practice scenarios with a partner or in study groups out loud. Be prepared to give and receive constructive criticism consistent with your department policies. This team approach will help you fine-tune your responses until you have mastered this skill. 5. Re-evaluate risk assessment. The fifth skill is re-evaluating risks. This involves re-evaluating the likelihood and consequences of potential risks and hazards. Paramedics and firefighters should be able to identify the probability and impact of various hazards, proposed solutions, and assess the level of risk involved. You are responsible for ensuring the safety of your teams and the public. Promotional testing tip. Be familiar with common risks and hazards associated with various emergency scenes, medical conditions, and know how to identify and manage them. Use critical thinking skills to re-evaluate the likelihood and consequences of task-specific potential risks. Demonstrate your ability to develop and re-evaluate a risk management plan. Be clear and concise. Thank you for watching part 1 of our 2-part educational video series on the top 10 structured risk management assessment skills for paramedics and firefighters. In this video, we covered the first 5 skills that are essential for first responders at the scene of a small or large-scale incident. Remember, completing a structured risk management assessment that is task-specific is critical to ensuring the safety of everyone involved in any emergency incident. It is essential to possess the top 10 structured risk management assessment skills we discussed in this video series. Make sure to watch part 2 of this series, where we will cover the final 5 skills that every paramedic or firefighter should possess to ensure a safe and efficient response to any size incident. Don't forget to click the link at the end of this video to watch part 2. Thank you for watching and stay safe.